Hello everybody, we are live on Facebook now. Sorry we're having some technical difficulties trying to get live on multiple streams. It's been a little bit difficult. I'm Dr. Kevin Connors. This is our Holistic Health Hour. Of course, we're not going to go a complete hour. We're going to answer some questions that you sent in last week, and certainly if you have other questions, we'll try to address those. If not today, we'll certainly get to them next week. We've had questions that come through on how to get treatment in our clinic. Just go to our website, Connors Clinic, CONNERS clinic.com, and you can see what we do and connect with us there. But that's not what these videos are for. These videos are really to help get information out. And you'll actually see that on our website when you look at it. We're trying to give away information, try to help people that we could never possibly help all around the globe. My book that just came out this summer, this is the updated 3rd edition. It's about 600 pages. It's free download, as well as all my other books are a free download. You get this in one PDF, so it's not a salesy thing or anything. You will go on our newsletter. It just gives you information, and again, nothing salesy. Otherwise, you can get this on Amazon or your local bookstore. And also go on our YouTube channel. We have over 400 videos that is just free information that can help guide your care, no matter what you're deciding to do with your cancer care, or Lyme disease, or autoimmune care. Just go and look up that information. So to address a couple questions that came in last week, and this is a question I get a lot in case reviews. That's my initial consultation with individuals. People say, well, I want to do an alternative approach, but my doctor is suggesting to do chemo or radiation or surgery. Should I do that first and then add an alternative approach after I'm done with that? And my answer is, that's not, I don't think that's what you should do. I think if you're going to do an alternative approach, do it concurrently with your standards of care. I'm not saying you substitute. You don't have to pick one or the other. Doing alternative care along with standards of care can greatly, in my opinion, greatly improve your percentage of positive outcomes. Of course, you want to utilize alternative approach. It isn't going to conflict with standards of care, meaning that if you're going to do chemotherapy, which is a strong oxidizing agent, you don't want to be taking strong antioxidants while you're doing an oxidizing agent. You're, in effect, negating the effect of the chemotherapy. But utilizing alternative care, utilizing the Rife machine, which you'll see on our website, I'm obviously very big on that, and that was another question we'll address in a second, can really help that your standards of care, I think, become more effective. Again, that's my opinion. I think it's you try to use as many things as you possibly can. If standards of care is giving you a 5-year life expectancy of X percentage, you certainly can increase that by doing other things as well. Looking at your diet, looking at nutrition, using equipment like the Rife machine and things can really increase your life expectancy and the quality of your life as well. Another question that comes in and that we get a lot, because if you go on our website, you'll see that we're really big in Rife Technology. What is Rife? A lot of people pronounce it different ways, but it's called Rife. It's named after Royal Raymond Rife, who came up with the idea of using light frequencies in healing back in the 1930s. And his work kind of went underground in the 1950s when the pharmaceutical and the AMA took over the practice of medicine and put basically everybody out of business, locked their doors that wasn't using pharmaceuticals to treat cancer. Well, his work kind of went underground for a period of time, and it resurfaced in the 1960s, 70s with some machines that were working, and now the type of machine that we use is much more powerful than that. So Rife Technology simply uses light frequencies to help the body recognize cancer cells so that your T cells and your macrophages, so your immune system can then more effectively attack it. Because one of the problems with why isn't my immune system, I must have a decreased immune system, why I got cancer, how can that be? I never got sick before. Well, part of the problem in your body being able to kill cancer cells is that cancer cells are your own cells. They're not like a pathogen, like a streptococcal bacteria that's invading your body. It's your own cells that are going through rapid replication and growing. So your own cells have a mechanisms that turn off macrophages and T cells so that your body isn't attacking your own cells. Of course, that would be an autoimmune disease. So in that, in your body's ability to turn off that mechanism, then your immune system less effectively recognizes a growing cancer as an enemy, and therefore you could have the healthiest immune system in the world, and your immune system is not attacking the cancer. So the Rife machine, by hitting the frequencies of those cancer cells and stimulating that, at the very least you're causing those cells to vibrate, and you're causing your immune system to now look at that again, you could say, boy, maybe we should do something in attacking this. So I do not believe the Rife machine is a cure for cancer, nor do I believe the Rife machine is any sort of panacea for any sort of disease. By using light frequencies to stimulate cancer cells, I believe you increase your chance of your T cells and your macrophages recognizing cancer cells as an enemy and being able to effectively do a better job to kill cancer cells. I also think that if you are doing standards of care, if you're choosing to do chemotherapy and or immunotherapy, using a Rife machine, I believe will help the cancer cell uptake those things better as well. So it helps the outcome even more so. So it's not an antioxidant, so you can do it right along with chemotherapy. It's using frequencies to hit those cancer cells and to stimulate your body's response to them. And that's how the Rife works. So what is a Rife machine? A Rife machine is a light frequency generator, so it uses a bulb, and the bulb is really the treatment part of the Rife machine that's laying next to you, you're snuggling with it, or it's on you or close to the cancer. So it's then penetrating your body and affecting, those frequencies are penetrating your body and affecting your cells. And you get some people like, well, I don't believe in frequencies. Well, your cell phone uses frequencies, so then you better get rid of your cell phone. So frequencies are all around us from a quantum physics perspective. Everything is frequency, everything is just energy that's vibrating at a specific frequency. So just because we don't fully understand it, and just because I probably am doing a really poor job of explaining it, doesn't mean it doesn't exist, it doesn't work. There are some books out there if you want to really dig into frequency and energy technology that are written by physicists and people much smarter than I am, that I would point you to look at. Another frequency choice to use with cancer patients is PEMF, and that was another question that came in, is the PEMF good for killing cancer? No, PEMF machine is a pulsed electromagnetic frequency machine, so it is not using light frequencies, and it is not, most of them, there are some that you could type in and use specific frequencies. So when we talk about a Rife machine, my definition of a Rife machine is using light frequencies. And how good is a Rife machine is, it has to be, number one, it has to be powerful enough to penetrate your body. Number two, it has to be programmable, so that, because it is the specific frequencies that you're using that make a difference. So I'll give you an example. We've had people that have said, oh, well, I've used a Rife machine and it didn't work. Well, what Rife machine did you use, first of all? And let's say they name a Rife machine that I think, in my opinion, is a really good Rife machine. Oh, you used a true Rife and it didn't work. Okay, so the possibility is that it just didn't work for you. The second possibility is you didn't use a good machine. The third possibility is, how often did you use it? And the fourth possibility is, what frequencies were you running? So if I run frequencies for a bacterial infection on a Rife machine, that's a really good Rife machine, and I'm using it long enough to effectively help my body kill the bacteria, but I have cancer, it's not going to help my cancer, unless the bacteria is a main cause of my cancer or something like that. So if I'm running thyroid frequencies and I have prostate cancer, it's not going to do anything for my prostate cancer. So you have to be using the right frequencies that are going to effectively affect that cancer. It has to be a machine that has enough quality that it's going to penetrate and effectively, make some impact on those cells that you're trying to impact. And then you have to use it long enough. So I've had people go, no, I've used a true Rife and I was using it on very specific cancer frequencies and it didn't work. Well, how often did you use it? Well, I had it at a doctor's office or a clinician's office and I'd go in every 2 weeks and do it. Okay, well, that ain't gonna work. So we write programs that people use all night long. So every night. And then if people are very ill and they're, less ambulatory and they're home sitting in a chair, they're running the program all day long too. So the length of time and how you use it, what frequencies you're running, there's a lot of different factors involved. But even at that, even if you're doing everything right, certainly you have to have, the person's body has to have an immune system that can effectively then attack that cell line and help kill it. And even if you have all that, the cancer may be too aggressive and too large. This is not a cure-all. So one question that you get, that I get frequently is, well, if Rife really worked, why isn't everybody using it? Well, nothing works for everybody. There's a chemotherapy that works for every breast cancer. So why are they still using that? The truth is there isn't anything that works for everybody. So you have to take a very specific, individualized approach to dealing with a cancer for sure. Cancer is not just one disease. It's a plethora of things that are going on. But a question just came in, what's the difference between Rife and conventional radiation? They're completely different. So Rife is using specific frequencies that do no harm, but will stimulate different cells depending on what frequency you're using. So if you're using prostate frequencies, it's going to stimulate your prostate cells. If you're using frequencies for a strep infection, you're not going to affect any of your human body cells. You're only going to affect those strep organisms. And there's actually video proof, if you want to YouTube it, using a Rife to kill paramecium. So you can actually effectively kill a single cell organism directly by using Rife frequencies. There's evidence of that. So the difference between Rife then and radiation, so radiation is high ionizing frequencies that are cancer causing. So those will kill cancer directly too, but it's like using a ray gun to kill cancer, and you have to go through other tissue and then pass through that cancer and therefore effectively pass through other tissue, because like a bullet, it doesn't stop and you do collateral damage. So there's you know that you're going to do collateral damage if you're going to use radiation to kill cancer. But does radiation kill cancer? Well, yes, it does, because basically you're using a ray gun to shoot through the body and destroy cells, but you'll destroy other cells in the process. That doesn't mean that it's not a viable option, and it's not an option that is sometimes the best option. But to couple that, again, with some alternative things that will help heal your cells that are damaged, the healthy cells, can even make radiation therapy more effective. So if we're going to use radiation, or we're going to use a strong poison like a chemotherapy, we want it to most effectively kill the cancer and do less collateral damage to healthy cells. And that's where coupling standards of care with alternative care often is the best solution if you do it wisely. So not saying that radiation isn't the right thing to do, but it is completely 180 degrees different than Rife technology. Back to the question about PEMF, pulsed electromagnetic field therapy. That's an electrical frequency. I would not say that kills cancer cells. I wouldn't say that it stimulates your body to kill cancer cells. I don't think PEMF is so much a cancer therapy directly. But what does PEMF do? If we understand what PEMF does, then we can understand that it is maybe a wise addition to somebody's cancer care. Because what PEMF does is helps increase cell health charge. Your cell membranes actually hold a charge. And that can be measured. That's what's called a person's phase angle. It's the level of resistance and reactance across the cell membrane, across a permeable membrane. And that's your phase angle. And that can actually be measured. So if you actually want to Google phase angle, you can see that most of the studies on phase angle are with cancer patients that are undergoing chemotherapy. If they can maintain their phase angle, even though they get really super sick, their chance of survival is high. They might feel pretty good, but their phase angle is plummeting, their chance of survival is less. So what is phase angle? That's the cell charge, the cell membrane charge. Well, what is that? Well, that has to do with cell health. And that is so phase angle is not specific to cancer cells or specific to any cells, it's just your overall cell charge. So when a person does PEMF, you are effectively increasing cell charge. Well, how does that help? Well, if you increase cell charge, you're going to increase overall cell health, which also includes immune cells, which includes the viability and survivability of healthy cells as well. So it can help a person who's going through any disease, PEMF can, because it will increase that person's ability to recuperate an immune response, especially if a person's doing chemotherapy, and will help hold that phase angle and hold that cell charge. So I think PEMF is a great addition to anybody's cancer protocol, but I would not call it's not a direct cancer killer. It's really totally different than a Rife machine, but it has a great purpose, and we use it in our clinic too. Another question came in last week about how do you address, do you think that past trauma and emotional wounds affect a person's cancer? I don't think anybody could dispute that emotional traumas in a person's life affect their health. It certainly has been shown to decrease an person's immune response. I think there's multiple studies out there that show that. And if a person does have a diminished immune response, your ability to fight infections that can get intracellular and then affect the replication of cells and therefore be actually the cause of cancer certainly exists. Do I think it's the number one thing to deal with? No, but I think in a holistic approach to dealing with cancer, looking at past wounds and past trauma is very healing in dealing with that. And that's dealing with forgiveness in your life, dealing with maybe asking for forgiveness in your life for wounds that you've caused to others, making sure that you're a good spiritual, emotional counselor, somebody in your church, somebody that you can trust, can be extremely beneficial. So I think there's a lot of great information about that. We've had a number of questions come in also talking about just overall sadness and depression. Now, even separate from cancer, what we've been dealing with this last year with COVID has isolated a lot of people. I would say it has certainly increased our society's overall clinical level of clinical depression, or subclinical depression for sure, of a lot of people, if not most people. And how do you deal with that from an alternative perspective? Certainly a person with cancer, when you hear the diagnosis of cancer, many people go into a sympathetic dominant fight or flight mode. It's very difficult for them to discern information, and maybe they follow a path that they later sometimes kind of regret. So dealing with that emotional issue, we're not talking about emotional traumas here, but the emotions of a diagnosis are very important. You'll see many places on our website, sometimes the best thing you can do when you hear you have cancer is to slow down and recoup before you make any treatment decisions. And I believe in most cases, you have more time to make a treatment decision than maybe you're told you do. Many people are just kind of herded down a pathway that is not necessarily in their best interest. And it's always best to take a step back, get some counsel, get some people around you that can give you a different perspective as you can slow down and make a better decision. But there are some, when we take on a cancer patient, we do a whole genetic workup on everybody. And there's very specific pathways in what's called your biopterin pathway, where these genes that make serotonin and make different neurotransmitters that are very important in handling emotional traumas, whether it's a diagnosis of cancer or it's isolation due to COVID, or whatever you're dealing with. And a person that has less defects in those pathways probably is able to weather those storms better than a person that has more defects in those pathways. So when we look at those pathways, supporting those as you couple that information with the person's symptomatic pattern, let's say they're dealing with depression or anxiety or rage issues or whatever, can be extremely important. So that is actually one reason why we look at those genetic pathways, to see that the whole neurotransmitter cycle, to help balance those emotional swings that we often get. And plus, those emotional swings do have a factor in the cancer growth often, because there's certain GLUT pathways and GAG pathways, genetic pathways, that promote the convergence or the transfer from glutamine to glutamate and back and forth, and that can be actually a fuel source of cancer, and that would be a major player in anxiety. So we see a lot of our cancer patients tend to have high anxiety actually previous to the cancer, when discussing their condition, had a history of high anxiety. And that can be actually a precursor, or at least now part of a fuel source to cancer, because many cancers feed on glutamines. So that's a whole other topic of discussion. Another question came in: where can I buy the best Rife machine? On our website we don't sell Rife machines. We take care of patients and we utilize Rife machines. And I have no financial interest in any of the Rife machines, and I just have an opinion, and my opinion might be worth whatever you think it is. But my opinion is the two Rife machines that we use in our office is the True Rife, that's a brand of Rife machine, and the GB4000. Now, we typically send people home or utilize the True Rife more, partly because of its programmability and partly because of its ease of use for patients. So both of those are important to me, because one of our philosophies in treating cancer is to help the person not make their treatment become too overwhelming, and maybe possibly even becoming a idol in their life, because that's all they're focused on. And I think, and my belief is, if that's all we're focused on is me getting rid of cancer, and I know there needs to be some laser focus for a period of time, but if that's all I'm focused on and that becomes my life, then what is the sense of me trying to get rid of this and living if this has become my life? So we don't want that. So we do like the True Rife. It's really easy to turn on and run at night. It's very simple. It's very hardy. I personally have one at home. I think it's 9 years old. It still works perfect. So it's they're good machines. You can certainly go to those companies directly and buy a Rife. So, and we have patients that call us and say, well, I can't afford to utilize your service. Can I just get a Rife? Yeah, just buy a Rife from them. We don't. So we're really in the business of taking care of people from a holistic standpoint and programming the Rife specifically for them and such. But you can utilize programs that are available out there too. So those are the two machines that we utilize. We have patients that come to us and go, I have a GB4000, can I use that? Yeah, you can. We'll program that. I have a True Rife. Can I use that? That's not uncommon. Where they'll buy a machine and then they'll use it for a while and think, I don't think I'm actually using this right. I don't think I'm running this right. I don't think I have it programmed right for me. And I need a more holistic approach. So that's who we're for. So not everybody needs us in that way. And that's why we give away this information for free. And that's why we do these videos, so that we can educate you, that you can help take care of yourself. And that's really what our goal is, so that you can take care of yourself. So should I do the questions that we went over today? Should I do chemo first before I do an alternative approach? My answer is no. You should do them concurrently if you're choosing to do chemo. Can I just do an alternative approach and not do chemo? Well, the choice is yours if you're an adult. You can make that choice. We don't enter into that decision. Is it right for me to not do chemo and just do an alternative approach? I can't tell you that. Everybody's different. But if I had my choice, I would try an alternative approach if I had time, if I didn't have a cancer that was so aggressive that was taking over my body. I would try an alternative approach. If I could get into remission with an alternative approach and keep chemo and radiation in my back pocket, that would be a whole lot better. Because if I do chemo to begin with and it puts me into remission, well, that's fantastic. But if the cancer comes back with a vengeance in a year, that chemo's not going to work as well anymore, if at all. And we're going to have to try, alternative chemos. And now I'm kind of in a pickle, and it would have been a lot better if I would have kept that in my back pocket and would have been able to put myself in remission with an alternative approach. Another question came in: what are some of the best things to do while you're doing chemo? So besides getting specific what we do on what is the specific nutraceutical that is going to be like a natural chemotherapy, what is the specific diet that you should stay off so that you're not actually fueling the cancer, and what are the specific Rife frequencies to be using while I'm treating my cancer. I mean, that's really what we do. There are some, we also have a chemo protocol. So if a person is choosing to do chemo, look on our website. Again, I'm going to point you back to that because I think we have 500 blog posts, and we do have a nice search bar that works really well on our website. So go to connorsclinic.com, go to our website, or there's a search bar. You go to our blog, there's a search bar, and look up chemo protocol, because the chemo protocol really helps walk through it. Again, there's some things alternatively you do not want to do if you're doing chemo. Again, chemo is a poison. By that I mean it's a strong oxidizing agent. That's what poisons are. And we're hoping by utilizing chemo that we kill the cancer before we kill the patient. And I don't say that that's a bad thing. That's a good thing. But there's, you don't want to, if we're going to choose to do chemo, we want the chemo to work. That's the whole idea of using a Rife while you're doing the chemo. It'll help, in my opinion, help the chemo target the cancer, and we get better results. But also, we don't want to do things that will negate the chemo. Chemo's an oxidizing agent. We don't want to use antioxidizing agents. Why would you use antioxidant agents anyhow? Well, you have oxidizing agents affecting you on a daily basis. Radiation from EMFs are oxidizing agents, can cause cancer. Chemicals from Monsanto are oxidizing agents and cause cancer. So you take antioxidants to help limit your exposure so that you negate those oxidizing agents and decrease your risk of cancer by taking antioxidants. But if you're purposely taking an oxidizing agent, aka chemotherapy, you don't want to use concurrently, at least within the first 48 hours of doing chemo. If you're doing weekly infusions or something like that, you don't want to be taking high antioxidants. So same thing with radiation. While you're doing radiation, it's not quite as important. With chemo, it's even more important. So that's something you don't want to do. So look on our blog, look at the chemotherapy protocol that's out there. That can be helpful for you as well. Okay, again, submit your questions. We'll log them and we'll try to get to them on a weekly basis. I have to get on to next patient I have here. So thanks for being here. Again, utilize our website, utilize our blog. Don't ever need to come see us or call us or anything. Download our book, get on our newsletter. That will be helpful for you. And we just are trying to be a blessing to as many people as we can. That's why we're doing these videos, and trying to stay as casual and, you know, as if we're talking to in the living room here as possible. So appreciate you. Thanks so much.